Dr. Sharma, many times we hear about a person who has suffered a heart attack, but who had no previous history of medical illness. He seemed to be leading an absolutely healthy life. And then all of a sudden, he suffered from a heart attack. So how can such a situation develop?
It can happen, and we come across this scene very often. As Professor Geelani said in the how the atherosclerosis form. See, this cholesterol plaque start developing in the lumen of the artery gradually. Initially, these plaques are soft. They are just rich in cholesterol. Over a period of time, there is a so-called fibrosis and calcification takes place, and this plaque becomes stable. But many of this so-called soft plaque, suddenly they may rupture and clot may form over it, and person may develop heart attack. So a person who was till yesterday said to be medically fit, no medical illness, can have such situation where already he was forming a cholesterol plaque, soft plaque which ruptured. Now, we have come across a couple of cases like people who are going to gym,
right,
and while doing strenuous exercise, they developed chest pain, and when they came, they had a heart attack. Now, what we found, basically, he had a atherosclerotic disease, and which during exercise, when the shear stress in the circulation increased, that caused rupture of the plaque and clot form over that segment, and person develop heart attack. So, number one, anybody who is looking healthy and is healthy can have this problem, because we do not know inside artery that atherosclerotic plaque is developing.
Right.
And for the plaque to give heart attack, not necessarily it has to be critically narrowed. Rather, literature-wise and experience-wise, I'm sure Professor Geelani would agree with my view that most of the heart attack occurs in the so-called insignificant lesion in the coronary artery, which are otherwise insignificant, 40-50%, 40% disease there. So any healthy person can have this problem if there is an undiagnosed underlying atherosclerotic coronary artery disease.
Right. So, sir, even if I understand correctly, even if one is asymptomatic and seems to be fit and fine, the process of atherosclerosis, as you describe it, could be going on in our arteries, narrowing them, and the plaque buildup could be taking place.
Yes.
And we may be totally unaware of it because we have no symptoms.
Yes.
Okay. Sir, what is the diameter of the coronary arteries? How wide are they?
See, these are the coronary artery has a main trunk and they branch gradually.
Right.
So average diameter, because Professor Geelani, being a cardiac surgeon, is every day opening and seeing, but we are seeing these arteries in the screen. So right. Average Indian diameter varies from 2.5 millimeter to 3.5 millimeter. The left main artery, which is right in the beginning, that is about 6.5 millimeter. But most of the major coronary arteries are somewhere between 2.5 to 3.5 millimeter in diameter.
Right, right.